Now, the resurgence of diseases outbreak in Nigeria comes like the cosmic force compelling leaders to once again shift politics away from governance. In spite of the deadly warning shots during the COVID-19 pandemic just a few years ago, have the leaders taking healthcare delivery as a matter of urgent national priority? A slip in another pandemic portends a huge danger, and Nigeria, if not prepared, might be forced to pay a very costly price. No doubt, the HMPV outbreak poses another reawakening call we all need to nip in the bud. It's my pleasure, therefore, to have Nigeria's Minister of Health and Social Welfare, Muhammed Ali-Pate. He joins us on Arise Prime Time. Glad to have you, Minister.
Thanks for having me.
Let me start from there. Just like, I just finished reading the news a while ago on the world, and just like it was with the HMPV outbreak in China, Ebola has broken out in Uganda just recently. So should Nigerians be agitated?
I think we should not lower our guards against infectious diseases. The threats of infectious diseases is real and has been accelerating over the last 25 years. From Nipah virus to Hendra virus to SARS in 2003 to the pandemic influenza 2009 to Middle East respiratory virus in 2012 to Ebola in West Africa in 2014 to Zika virus in 2017 and to COVID-19 in 2020. So you can see the interaction of humans, animals, and ecology brings pathogens, infectious agents from animal world to encounter humans. Right now, you have heard about Ebola that is showing its face, but there's also the bird flu in the United States, which has moved and is brewing, hasn't been successful in transmitting from person to person, but it symbolizes this possibility that zoonotic diseases from animals can spill over to the human side and cause damage. So that is the backdrop. And if you recall the Health Sector Renewal Investment Initiative, which was unveiled by President Bola Ahmed Tinubu in December 2023, envisions 4 pillars: how we govern the health sector, federal government, states, local government working hand in hand, private sector, civil society, to look at the health of our population, respond to our citizens' needs, but also be on the watch to improve our health system so that it's able to respond and deal with situations, deal with the current issues of hypertension, diabetes, malaria, but also be able to respond, whether it's primary health care expansion or the higher level care, and our human resources, where we've retrained more than 53,000 frontline health workers in the last 1 year and are dealing with the human resource capabilities. And thirdly, to begin to produce what we need in terms of the value chain, masks, caps, protective equipment, that we don't have to import them. You recall in COVID, we imported masks from China. This is textile. So how do we begin to produce the basic things that we need? It requires an industrial base. It requires proper regulatory environment. It requires a private sector that is also vibrant, not only domestically, local manufacturers, but also others who can invest in it. And fourthly, we had a pillar on health security to ensure biosecurity. Through the NCDC, through the ministry, through a multi-layered approach to ensure that we are securing, because health security is linked to economic security, is linked to national security. When COVID came, it caused a 5.5% decline in global GDP, trillions of dollars. When Ebola happened in Lagos, it stopped the private sector from doing the business that it needed. So health threats can be an important shock to economists. So that's why this administration took health security as a standing pillar. And with climate, we saw the displacement. So all in all, when you look at the last year and a half, for instance, there are several outbreaks that tested us, and Nigeria has been able to show its muzzle. Whether it's diphtheria outbreak that was rampaging in 2023, we're able to quickly tamp it. When early 2024, we had a beginnings of outbreak of meningitis in some parts of the northeastern Nigeria. We're able to be the first country to introduce the pentavalent meningococcal vaccine, and that outbreak didn't spread, and people are not aware of it. When we had cholera outbreak, there were cholera outbreaks in eastern and southern Africa, hundreds of thousands of people affected. all over the world there were cases of cholera, including some French islands. Nigeria rapidly mobilized. The president set up a cabinet committee, multi-sectoral, had environment, water, health, aviation, education, to really look at how we work alongside the NCDC to see how we tamp it. We are able to numb that. There are other outbreaks, monkeypox, which happened in DRC and other parts of. We were the first country to get the monkeypox, the mpox vaccine in Nigeria, and we're able to strengthen our surveillance and be able to use the public health measures. And thankfully, it has not been the hundreds of thousands of cases that we have had elsewhere. So when the human metapneumovirus emerged in China, I think we have to say that that is not a new virus.
Yeah, it's not.
It's been a virus that has been existent. It has been with us. It causes a lot of atypical pneumonia, viral pneumonia. It's just not tested enough. Immediately we got wind of it. The public health infrastructure we had was activated. The thermal sensors in our airports to pick up cases that may have fever, the surveillance system, the influenza surveillance sites were quickly refreshed to ensure that we have good surveillance system. And thankfully, we did not see a noticeable increase in terms of the acute respiratory illnesses. But that doesn't mean that we have to we can lower our guards and be complacent.
Yeah.
So we are standing firm and doing the best that we can in terms of ensuring surveillance, in terms of preparedness, and also the preventative side in terms of preventing spillovers. And that will require a lot of work from not only us in the human health arena, but even our colleagues in the veterinary arena will have to work together with us. Yeah. So in all, and from the feedback that we have received, I think there is increasing confidence by Nigerians in terms of the ability and the competence of government to respond to health emergencies.
So can we then say, with a level of confidence, or maybe you could add percentage to it, that we are prepared in the event there's a sudden health emergency? Can we confidently say that?
You see, Mike Tyson, the boxer, had a saying that everybody has a plan until he's punched in the face. Then he realizes that the plan is not up to par. I think we're doing our best to prepare and to keep our muscle memory and to respond, and we've demonstrated that repeatedly. But we cannot accept that just our plan is by itself sufficient, so we have to be on our guard. Now, we asked Nigerians in the 2024 Population Perception Survey, we asked Nigerians, what is their perception of the competence of government to respond to health emergencies? And they gave us an answer. 54% said they are confident in the competence of this administration to deal with health emergencies. That is not me as a minister saying, or it's not the president saying. It's a survey that was conducted by NOI polls. And for us, it shows that whatever work the Nigerian health system is doing, whether it's federal government, whether it's states, our development partners, are tremendous health workers, that it is seen and given confidence. And why is that important? If people are confident in the competence of the sector, when there is an emergency and we say, wear a mask, behave this way, wash your hands, people will comply. When there is no confidence, mistrust and misinformation can come in, and people may not comply to things that may not be even in their best interest.
All right, how do you make, or what do you rather make of the fact, or why is Nigeria traditionally, I had to put it like that, continuing to factor continue to fail rather, or falter, over the Abuja declaration of 15%. The budget they say is 2.8 trillion, that's about 5.2% of total budget.
So the issue of 15% Abuja declaration, if you look at the African continent, this was done in 2001. There are only about 3 or 4 countries that were able to meet that, and even them, they also slid back. It's not necessarily the best metric because nobody was able to meet it. It's also a function of how much revenue does government have and among the competing priorities. We had been collecting lower proportion of our GDP as government revenue of which they will then appropriate some to health, and households come in with the complement. So for us, in this health sector renewal investment initiative, in line with the direction that we're taking under the leadership of the president, is to say, let's use what we already have and use it well. So let's have more bang for the bucks that we're spending, even as we increase the resources. So there's an efficiency argument, which is focusing on the priorities of the primary health care, on the frontline health workers, on service delivery, on commodities that will reach Nigerians, and increase the resources. And in 2024, the president really deliberately, not accidentally, increased the allocation to health. And in 2025, the proposal that he has put out there has some important additional constructs. And our issue now is to prepare to deliver on that mandate, whether it's on the medical relief program to lower the cost of access to service, whether it's expanding the primary health care that we have started to do more, whether it's expanding affordability to ensure Nigerians are able to afford those care, whether to finish the cancer centers or the infrastructure in our hospitals so that we have the ICUs that we do, whether it's to retrain our health workers or even the enablement that the health workers have, and at the same time to bring investments that for people that will come and invest and our local manufacturers to begin to produce what we can use.
You've raised up so many issues I want to discuss, and the time is not just there. Now, who says 80 to 90, WHO, sorry, says 80 to 90% of healthcare needs can be met at the primary healthcare level. But primary healthcare systems are weak in half of Nigerian states. How do you plan to change this narrative?
I think, first of all, just to interpret carefully what the WHO is saying, the health sector, at least the Nigerian health sector, its clients are the 230 million or so Nigerians, some of whom are healthy, whom we want to keep healthy, so they are well. A few may be sick, but they don't know yet they are sick. We want them to know quickly so that we can take care of them. And some are sick, and we want to take care of them. And the best way to take care of them is based on the severity. Basic elements should be attended at primary health care. Preventive things, immunization, antenatal care. But when there are complications, whether emergency obstetric services can be referred so that mothers don't have to die because of pregnancy complications. And they should afford it. So that's the way we are looking at it, and strengthening our primary health care as a foundational element so that someone will not go to a teaching hospital to have his malaria treated or a walking pneumonia. Ideally, that's what we should be working towards. And that's what we've been doing with the states, with the investments of the federal government through the Basic Healthcare Provision Fund to ensure we have a health system that is looking at the totality of the health and well-being of Nigerians, promoting health, preventing diseases that can be prevented, and basic ones can be treated at primary health care, and severe cases, cancers, kidney diseases, make them affordable and Nigerians to afford them in the higher level facilities that have competent health workers to be able to address them.
Yeah, you talked about health workers. Let me just tackle that immediately. You intend training frontline health workers with the objective of 120,000 by December 2025. Am I right?
Yes.
Good. So what?
2027.
2027.
Yes.
120,000 by 2027.
We announced that in 2023. And we have trained in 2024 alone more than 53,000 frontline health workers all across this country. And we are going to do more. We will hit our target long before the 2027 date that we had assigned.
Okay, we'll hope that eventually happens. In the face of hardship and high cost of living, how are you tackling the challenge of urban-rural disparities and health care delivery, access to health care facilities, especially for the vulnerables?
So there's a vulnerable groups fund that in this 2025 is being expanded significantly, which will channel resources for poorer populations to access primary health care for basic. We've also made emergency obstetric services through NHIA affordable for women who need them, who are eligible in empaneled facilities. Women who have obstetric fistula receive those repair in our facilities free, and more than thousands of women have already have their repairs. So by dealing at the front lines, we're also addressing the rural areas, but the urban areas are also left behind because there are poor people living in urban areas. and strengthening the primary healthcare system and working with the states where they are revitalizing more than 2,000 primary healthcare centers through what we call impact across the country with resources that are available to the states, which is to make them functional so that they look decent. We want primary healthcare centers to look as where you go and get healthier. So that effort is already underway. Importantly, in the president's effort to bring succor, relief, he also indicated that we should embark on a medical relief program whereby government contributes in terms of lowering the cost of pharmaceuticals, critical form, antihypertensive, antimalarials, by bulk purchasing directly from local manufacturers, whether they're available, or others who may be outside that, and distributing them. And that, I believe, will bring a lot of relief to those who are hurting from the rising cost, because we know that Nigerians are facing some of those challenges. And this is a responsive government that is listening to that and trying to respond to that. And that will ensure that we're in Nigeria where we don't leave our citizens behind. Whether they are poor, whether they're disabled, whether they are women, whether they're elderly, we do everything that we can. That is what the federal government is trying to do. And we are also working with states to see that they also key in and contribute, and even local governments, as they get resources, also to chip in. Because if there's one thing that all of us are in together is health. All levels of government and the private sector and even external partners, because some of these diseases know no borders. Infectious diseases don't have passports.
No.
They don't need visas.
They're not your friends.
They can go anywhere. So we need to unite around that, and that's where we're headed.
Okay, you and I were born by women. So we can't finish health without talking about women. Yes. Records show that Nigeria accounts for 20% of all global maternal deaths. Nigeria accounts for 20%. What is your ministry doing to change this? You talked about VVF repair program, but you didn't include that. Maybe you should include that. The C-section, I hear, is free.
We have put in mechanism through NHIA to ensure that women who are eligible to have those cesarean sections can have them and the hospitals be reimbursed, and the quality of that to be at par, so that we don't have low quality services being offered because people can't afford it. Yeah. Women's health is a key issue, and I just saw your correspondent who was with us at the World Economic Forum last week in Davos, where the World Economic Forum picked Nigeria based on what this president is doing and said, look, we want you to be in the board of the Global Alliance for Women's Health, and we want to sign an MOU with Nigeria on the Global Activator Network on Maternal Health, because they have listened and carefully seen that we are aggressively attacking this issue of maternal health. We launched MAMI, a maternal mortality and neonatal mortality reduction initiative, focusing on the 172 local government areas that account for more than half of women dying in Nigeria. So using good data and mobilizing on the supply side, the human resources, the facilities, the states, but also on the demand side, the affordability. I believe with the innovations that are coming in, whether it's to reduce postpartum hemorrhage and deal with it, or the emergency obstetric services and other interventions, whether it's multiple micronutrient supplements that we're distributing to ensure the women are nourished so that their gestating babies are also stronger, so that we have healthier children coming from them. And
of course, a better nation.
And a better nation. So those are all the things. But women's health goes beyond just pregnancy. There are non-communicable disease, hypertension, diabetes that affects women, cardiovascular disease, heart disease, mental health. There's so many other ramifications. And women tend to carry a burden of care. But importantly, there are also more than 60 to 70% of the health workforce, nurses, midwives, community health workers, many of the doctors, pharmacists are women. And they deal with many other issues, and yes, they are also health workers. So women play a very important role in the health sector. And I think under the Health Sector Renewal Investment Initiative, women's health is a very important part of that. And women leadership is also part of what we're trying to advocate for, including in the National Health Fellows Program, which we have kicked off. And I think we have had at least 300,000 applicants, young graduates, that we want to ensure men, women have opportunities across 774 local government to participate, but also to be coached and help to develop into leaders. That is the National Health Program, Health Fellows Program, which the President approved, and we're very glad that at least he saw it as an important element for us to do, so that not only we are building and transforming our health sector today, but we're also trying to build a cohort of leaders that will endure over time, that will keep making sure the health system functions and serves you and I and others when we retire, that we have also others who will build on them.
All right, I will not let you go without putting in this. I wish I had time to talk about the expanded, the 2.4 million Nigerians expanded insurance scheme, but I don't have that time. Let's talk about attrition of professionals and then the question of strike. I don't know whether you can do that in 1 minute.
I can do that, and I'm sure you can give me another minute, but I'll say that there's an interesting phenomenon happening right now. There are people coming from outside Nigeria to Nigeria as we speak to get medical care. So we have good things happening here. We have good health workers all across our facilities. You may not want to believe it, and Nigerians are skeptical about Nigeria, but there's something that this government is doing that is noticing attention. I have seen myself people who have come from outside, some people who have come from the UK to have surgery here, from the US and other places. Believe it or not, that is happening. Those that are here, we respect and appreciate them. And we're working with all the health workers to ensure that, in fact, we preserve the harmony that we have enjoyed. The President has given all that we need, including some very difficult issues, such as the retirement age and all of that for clinical workers. We're working very hard to operationalize it, following due process and following the establishment rules. But the President has given his note that, look, this is important so that we have the workforce that we need, and we'll follow due process in ensuring that we attend to those. And there are many other issues that have been long-standing, that one by one we're trying to address them. And we count on the continued support, partnership, and we put Nigerians at the center of attention. If we do that, the issues of strike in the health workforce, I believe, will be abated.
All right. Thank you so much, Minister, for your time. Interesting discussion with you. Thank you for being here.
Thank you.
All right. Well, that's it for this edition of Arise Primetime. Do join us again from me and the entire team here in Abuja. Goodbye, and thank you for watching.